No one likes having surgery, but now a new laparoscopic procedure means fewer risks for the patient and a much faster recovery period. Here's what you need to know about this surprising new innovation.
It's nothing. No scar at all.
I feel wonderful. I highly recommend it.
Not exactly what you'd expect to hear from patients just 17 days after having a hysterectomy.
Getting back to work this week, no problems. You know, I was a little worried that maybe once I started back I'd get tired or something, but although I've eased into it, it's been just fine, and I've felt absolutely fantastic.
That's because both these women had hysterectomies with a new laparoscopic technique using a single site. So instead of 3 small incisions or 4 or 5 with robotic surgery, the surgeon instead makes 1 incision about 1.5 centimeters in the curve of the belly button.
The recovery for laparoscopic surgery, generally they're in the hospital maybe 1 night. For an abdominal, it's 2 to 3 days at least. The infection rate's a lot higher with an abdominal surgery as well. Right now, as far as hysterectomies, in Dayton there's about 2,000 done a year, and about 50% are still done abdominally.
Dr. Lisa Kaufman is the only doctor in Dayton performing laparoscopic surgeries with a single incision, and one of only 10 statewide. Dr. Kaufman says it's hands down the best choice for patients. It's less painful, has a faster recovery time, and virtually no scarring.
I'm really surprised, I really am, because I didn't expect to be up and, you know, moving, you know, like I am, but I highly recommend to do it this new way that, you know, Dr. Kaufman is doing it.
I can't believe that I haven't had any pain. I keep wondering, did she really remove my uterus? Because I don't feel, you know, anything from it. You would expect there would be some discomfort.
But Dr. Kaufman warns not everyone is a candidate. She recommends anyone needing a hysterectomy or any type of surgery to explore their options.
There are still some patients who do need to have abdominal hysterectomies, and not all can have minimally invasive. But I would say probably we could, as a OBGYN community, get that number down considerably if everybody was trained appropriately for that.
Now, this procedure can also be used for some general surgeries and other gynecological issues as well, and is covered by most major insurance companies.